First and 11 discussions are underway to try and help around 25,000 Rhode Islanders who are now in need of a new doctor. That's after Anchor Medical Associates announced it will close its doors this summer. Thanks for joining us. I'm Kayla Fish.
I'm Mike Montecalvo. 12 News reporter Alex Torres Perez goes over what's being done to help these patients and the calls for change some are pushing for.
Mike, Kayla, finding a new primary care doctor in Rhode Island isn't easy, and many of Anchor Medical's patients tell me they're unsure of what they're going to do next.
Anthony Poirot has been an Anchor Medical patient for more than 30 years, but now he, his family, and around 25,000 other Anchor Medical patients are going to have to find a new doctor.
It's very, very, very stressful, but it is what it is.
Anchor Medical Associates will be closing its pediatric and adult office in Warwick at the end of the month, and its other offices in Lincoln and Providence in June. In a notice to patients, the company explains, quote, "We have been unable to hire replacements for our physicians who have retired over the course of the last decade. While costs continue to rise, reimbursement rates make it extremely difficult to attract new physicians to our state, an issue healthcare providers across the state are also having to deal with."
Primary care is not as well reimbursed as other specialties. And so as a consequence, the newer graduates coming out of school tend to leave Rhode Island or to go into specialty. You can go to Massachusetts, Connecticut, and make more money for doing the same work. And so there's not an incentive to remain here in Rhode Island.
A spokesperson for Governor Dan McKee says the State Health Department and Office of Health and Human Services are reaching out with other healthcare entities who, quote, may be interested in taking on all or part of Anchor Medical's primary care practice. Something Rhode Island Attorney General Peter Nerona says he already tried doing when Anchor Medical came to him for help.
The reality is that systems lose money on primary care because of the same revenue problems.
That's why he's calling on the state to pressure commercial insurers to increase those reimbursement rates to keep primary care doctors in state.
We have kicked the can down the road for far too long. We can fix it, but not without leadership, and that's in short supply, sadly.
In the meantime, some healthcare providers like Greenwich Bay and Blackstone Valley Medicine say their doors are open to help any patients looking for a new doctor.
Don't panic. We're here to help you. And if you call, we'll try to address your needs as best as we can.
Anchor Medical patients are recommended to get their medical records as soon as they can. They can also reach out to their insurance network provider for a list of doctors accepting new patients. Reporting in studio, I'm Alex Torres Perez, 12 News.